up that won't walk. I speak to you, my heart and my soul, my family and folks who I surely owe. My 100 double O nigga ride a flow to the beat, here we go. And it's so. I was born in the city of dope. If you survive with the live, gotta pray to cope. When the players lost their collars on the fade stroke, 76 keys of F3, I'm ready to go to the land with the head.
Hello, and welcome to another edition of Education is the Best Medicine. And thanks for watching. And remember, public access is your best bet. Today, we are honored to have Ms. Marilyn Murray. She's a volunteer legislative ambassador for the American Cancer Society. I asked Marilyn to come in and talk to us about some of the concerns and issues around cancer in our community. She's a well-known speaker in the area, and we've had the pleasure of listening to her insight, and I thought it was very important that we bring her on today to have some conversation. Marilyn, welcome. Thanks for coming on.
And thank you for the opportunity to be here.
Tell me how you got started in this, and tell me about the American Cancer Society and how you function and some of the good things about it.
I got started as a volunteer because there were so many members of my family who died from this, quote, cancer. I had really no idea what it all encompassed, but I knew that it has stricken a lot of members of my family and that they had suffered and died from this disease. So my first initial motivation was to find out as much as I possibly could about cancer and how I could hopefully save myself from being diagnosed with this disease.
Yeah. Well, we know African Americans bear the brunt of cancer. It's second only to heart disease in terms of the levels of death. Some of the primary cancers for men are lung cancer, prostate cancer, and colon cancer. Some of the primary cancers for women are lung cancer, breast cancer, and colon cancer. What do you think has been the reason for such one, the rise in terms of cancer deaths and the stabilization, but still higher than most of the national average in terms of these both cancers?
Well, I believe that we can look at this in two ways. The rise could be that there are more individuals who are going through the process of getting the cancer screening test. So that could be that once you get more people to get the screening test, there will be a momentary increase in the incidence of cancer because we're finding it more and more. However, when you look at the statistics, you will see that for some reason the incidence of cancer and the mortality rate of cancer in African American community is higher than it is in other communities.
Go.
And I'd like to start now with what I would normally have in the ending is that screening tests do make a difference. And part of what we're doing is to encourage and motivate individuals to get the screening test, the appropriate screening test at the appropriate age in their life, and sometimes even earlier.
Okay. I'd like to also refer people to the American Cancer Society's website, as well as their document on the American Cancer Society. Specifically, it has a host of information and it's multi-ethnic in nature. In particular, there's discussions around African Americans and their, I call it their white/black paper for cancer in our community. I think it's a telling document. Some of the interesting things were that, again, cancer deaths are only second to heart disease in terms of deaths. And cancer isn't just the abnormal cell replication. We think it's a host of triggers, factors including racial, cultural, and spirituality issues. And again, the burden we seem to find is economic and social healthcare disparities. Do you find that to be the case?
I do believe that it is a combination of all of that, of what you just said. However, there is another component to that. There are lifestyle choices that we make that also affect and increase our risk for being diagnosed with cancer. And some of those things we can do very easily to make a difference in our life, like eating a proper diet with 5 servings of fruits and vegetables per day, physical activity, at least 30 minutes of activity no less than 5 days per week, and one of the major ones is smoking cessation. If you smoke, stop smoking.
I understand also, if you're interested in some of the advocacy issues and some of the bills that are coming out, the American Cancer Association is sponsoring, particularly in California, you might want to again check their website out. I think we have to get involved with organizations like this. Whenever organizations like this come to the table and want to have a discussion with us, we really appreciate that, because we think it's really important that there be a connection between communities like ours and organizations like the American Cancer Society in order to, again, reduce the incidence of death and disability from cancer. What have you seen as some of the major changes in the American Cancer Society as it relates to reaching out to people of color, African Americans in particular?
Some of the major changes in our society is, first of all, and this has been going on for some time, but now we're beefing up our efforts to reach the African American community. First of all, we have a specific strategic plan for the African American community. And we didn't do this willy-nilly. We came together and we got outside input to come up with just what it's going to take to reach the community, to raise awareness about cancer early detection and prevention, about the kinds of things that individuals can do to reduce their risk to cancer. And I just want to go back to legislative advocacy in a way. The American Cancer Society's major thrust is to find a cure for cancer through research. We know we cannot do that alone. That's why advocacy is so important. We're not saying vote for this candidate or the other, but what we are saying that certain candidates support our cause and thereby giving us the funding dollars to, let's say, the National Institutes of Cancer to assist us in finding a cure for cancer. And that's why advocacy is so important, because we can't do this alone, and we know that in this major time of budgetary cuts, we need everyone to really utilize the power of their voice and the power of their pen when it comes to voting for the candidate that supports the causes that are really going to support them.
In other words, we want to look forward and kind of be keenly aware of legislative concerns, as well as bills that might be coming or to the table to maybe have a discussion about the cost of cancer and how we can limit that by maybe limiting the costs and increase the cost of cigarettes, that kind of thing.
Absolutely.
But again, you know, people don't like taxes, but again, this is not a tax as opposed to a discussion around health.
Yes.
What have you found, again, in terms of this far-reaching plan that the American Cancer Society has had, and particularly with a target for African Americans? What have you found some of the specialized issues that we've had to face? I know there's issues of economics, of racism, healthcare disparities, lack of providers. You know, we tend to get diagnosed later in terms of the cancer, and it tends to be more of a higher level, and that goes for breast cancer, prostate cancer. Does the American Cancer Society look at addressing that issue? And I think they do in their paper, I review.
One of the major issues that we find in all communities of color are communities that are underserved or underinsured or uninsured, and that is access to care. And that is our major focus, in addition to the other topics that I'll share with you in a moment. But access to care is one of the major ones, and it doesn't necessarily mean that an individual doesn't have money or doesn't have insurance coverage, but access to quality care across the board. And so, because that is a key issue here in your survival from cancer, we are raising awareness about the kinds of things that you should look for when you're trying to get this care, the kinds of questions that you ask. In addition, we're trying to dispel those myths that are surrounding cancer. Some of the myths. Some of the myths is that what you don't know won't hurt you. The Lord has placed this burden upon you, and so be it. What will be, will be. But what I am here to tell you is that early detection and prevention can save your life. Okay. One of the major issues that affect us is that cancer is detected and diagnosed in the latter stages. So it behooves us to, women get a mammogram on a yearly basis, get your clinical breast exam, get your pap smear, get your colon tested at age 50 or whatever is appropriate for you. If you have that in your family history, then you want to get it done earlier. These are things that we can do. Then there's a whole issue of trust. If you are with a provider that you don't trust, then it's your responsibility to pursue getting someone that you can trust. Just like you would when you're going to go and buy a car. You don't just go out and buy any car. You want to test drive the car, you want to see all of the amenities, and the same thing is true when you want to select your primary care physician. You want someone you can trust, you can talk to, someone that you can communicate without hesitation, and someone that you feel that's there to take care of you.
And that may not necessarily be a person of color. But,
It may not
but
necessarily
they
be a person
will
of
be
color.
culturally competent. They will understand the
Absolutely.
issues of racism, healthcare
Absolutely.
disparities as they evaluate you. They will understand the fact that we are usually limited in our testing, not giving the appropriate testing, and coming too late for the testing. Those are things that provider, regardless of what color,
Yes.
should be evaluating in an evidence-based medicine approach. And we think that that's
Absolutely.
really
Yes.
important that we get that word out there, that we're not saying that the provider has to be a certain color, but he has to be of a certain stock and attitude in regards
Absolutely.
to one, evaluating these things and getting us to aggressive
Yes.
early treatment.
As a matter of fact, I'm glad you mentioned that, because one of the things that we are doing is that we're reaching out to the medical community, and we are insisting that they bring to the attention of their patients that at a certain age you need XYZ test, and to follow through to make sure that is done, and to make sure they're getting the proper awareness based on their particular medical history, and encouraging us as individuals to share what's in your family history: diabetes, heart disease, cancer, all of those things that we know can affect us. So we're reaching out not only to the community, but we're reaching out to the medical community also.
One of the interesting facts I saw is that African Americans have a 20% rate of diagnosis, men in terms of all cancers, but they have a 40% rate of mortality, death, than their white counterparts. This is just unacceptable. And the flip side is true for women. I would even dare to say that we are continue to be underdiagnosed, undertreated, and underevaluated, and that's one of the major concerns in regards to our 5-year survival rate, which is a discussion around if I get a cancer and my white male counterpart gets a cancer, in 5 years I'm likely to die from that cancer, and that's unacceptable given this issue of treatment and rent.
It is unacceptable, and one of the things that I want to let you know is that if an African American woman and a Caucasian woman are both diagnosed at the same stage of cancer, get the same level of treatment, the prognosis is the same. However, what happens is that many times in the African American community,
so you have to
with the black
explain
woman,
that to me, because I'm a prognosis. What do you mean?
in other words, the outcome.
Okay, the
The
outcome.
outcome will, if the two individuals are diagnosed at the same time, at the same stage in their cancer,
Okay.
receive the same quality treatment
Right.
or level of treatment, the outcome is predicted to be the same.
Okay.
However, the disparity comes in whereas in most instances for the African American woman, she has not gone in to get her mammogram, and she may be diagnosed in stage 3. And then she may not receive the same quality of care.
Of course, access issues.
or follow through and all of those other, just she may not know, and the doctor may not offer her the same level of quality treatment.
Okay.
And that is one of the issues that we're addressing, so that we can raise the awareness to the individuals. And part of that is one of the services that we offer, to be a patient navigator. We have programs that help an individual walk through this system, because it can be frightening and very confusing.
And again, African Americans tend to get diagnosed later in stage, and people of color tend to get diagnosed later in the stage. We're seeing a large discussion around liver cancer from hepatitis C in the Asian community, which again is underdiagnosed, undertreated. It's not that sexy discussion that we're having, but folks are dying and dying needlessly. So we want to get trumpet in all communities: Hispanic, African American, immigrant, all communities, because cancer affects all communities in one way or another. But again, the disparity tends to affect people of color, particularly Africans born in America.
There's one thing I want to add.
Sure.
There are some programs that are available here in California, and one of them is the Breast Cancer Early Detection Program. And unfortunately, it is only utilized up to 20% by African American women.
Why do you think that is?
I think, again, is lack of awareness that the program exists, lack of trust of the program. Again, it goes back to, I don't really want to know. And all of those things could really be a determinant to your not being a survivor from cancer. So what we're trying to do is say, mammograms do make a difference. Mammograms do detect breast cancer in the very early stages.
Because there's been some discussion around that. Early mammogram versus early colon test versus no mammogram versus no colon test. Example, we do see that we're seeing breast cancer in younger women. So the idea of having a cutoff for mammograms at 40 in a group that may be more predisposed, have a higher risk of cancer, is just concerning to me. What is happening in regards to getting that kind of word out to say that you may not be in that age group that says, oh, because of the guidelines, you shouldn't have a mammogram, but in regards to your family history and risk and lumping your breast, you should. You should be have checked out.
Well, again, that all ties in with the initial advocacy whole factor that you talked about that has nothing to do with legislative advocacy. It ties in, if you have a concern and you have a symptom, first knowing what the symptoms are. And you have a symptom, if you have a breast or you have any kind of anything in your breast that was not there, let's say a time in the past, then you must diligently and persistently pursue trying to figure out just what this is and not be put off when the doctor says you're too young. This couldn't possibly be for you. There's no history. We do know that individuals are diagnosed with breast cancer who have no family history. But again, individuals do know their bodies. So again, that's where we are advocate for our own health, where we pursue it consistently until we find someone who will listen to our concern and take it to the levels that it needs to be taken to.
And again, I'd like to thank you for coming on and sharing your vast wealth of knowledge. I'd like to thank the American Cancer Society and Mr. Shattuck for allowing and getting you here and being so diligent about that. We really want to partner with the American Cancer Society in regards to, again, getting the word out for evaluation, early treatment, and dispelling some of the myths. Is cancer in our community, particularly African American, still a taboo word?
Yes, cancer is still not an open discussion as it could be. It's a medical situation. It is not something that deals with voodoo. It is something that affects us. We don't know. If we know what really causes cancer, then we could hopefully find a cure. So we know what triggers it, but we haven't found the actual cure for cancer. And the more open we are in our discussion about cancer and cancer awareness, what the symptoms are, the avenues that an individual can take to reduce their risk from cancer, the avenues that an individual can utilize to be detected early if by chance they're being detected with cancer. Early detection is the key to survivor. I just want to mention African American men and prostate cancer. It is in fact true that prostate cancer in African American men is very aggressive. We don't know, but there are researchers who are trying to find out exactly what the reason is. But there's something else that's a part of that. African American men consistently are diagnosed in the latter stages. And there is a taboo about getting the PSA test, which is the prostate-specific antigen test, and the digital rectal exam. There's still a hesitancy to getting those screening tests, and they are considered just a momentary inconvenience for something that could save your life.
Well, so we get to a deeper discussion then about mentality and about how we think about this system. And we can only say that the level of trauma that has happened to us as a culture and as a group of people has led to our distrust of the medical system. We are still only 100 years removed from slavery. So again, a lot of the fears and concerns around a healthcare system that denied access and continues to deny access, whether you have money or not, seems to be a consistent picture for us. I think that we need to really review culture and review Western medicine's place in doctrine in terms of how people of color have functioned in the system, because we haven't functioned well. And I think one of the reasons we want to have you come on and have as a representative of the American Cancer Society is to talk about those issues and to break down those barriers so we can get people screened and treated.
I do believe there are instances, and many of them we all have experienced them, where we have not received the quality of care that we should have received, and we did not receive it in a timely manner. I do want to say that I believe that that is changing. I believe that we must also take the time to find those medical physicians, find this information out, do what we can to take care of ourselves, to pursue not being caught up about what happened in the past, but know that there are physicians out there in the medical profession who want to give us the best quality treatment.
I have to take issue with that, because I always hear this from folks about forgetting the past. And I think that's the problem. We have forgotten the past. We have forgotten the fact that that we weren't taken care of as a group, so we had to be more advocacy based. We had to be, as a group, go and talk to folks. We had to support one another. So that's what's been forgotten in this, because when we go to a system now that has been disingenuous to us, has not respected us, and as you note, and as this document in Cancer 2006 by notes that the social economic disparity still exists. We have to talk about this. That's where we disagree.
Well, it's not that I disagree with you. It's just that I am saying that don't let the past be a barrier to you doing your best to gain access to the care that you deserve. I'm not saying for one moment forget what we have experienced and forget what we have gone through, but use that as a guide to what you don't want to experience now, and to know that in going forward, you know what you've experienced. You don't want to go through that. You don't want to go through that again, and you don't want to go down that road again. And when you arm yourself with knowledge and with information, you know what to seek and what to stay away from. So I say use it as an informational tool to catapult you to the resources that you need to help you save your life.
And again, this is why you're here, because we feel that that's going to be the key. Education is the key. This is why we call this show Education is the Best Medicine. We feel that to have this kind of platform and to dispel rumors and myths and move people forward is our prime objective. And we want that system to move forward and make it a prime objective to change and to address these issues, and not to consider it as whining or crying or whatever. So again, advocacy means to me getting it out there front and discussing things even though they're uncomfortable, even though you're unhappy with them, even though it doesn't tell you what you want to hear, because in reality, a lot of the discussions around quality providers gets back to cultural competence. And it starts in medical school or PA school or nurse practitioner school. And if that mindset doesn't change, then here we are. That's why we're number one, not number one in terms of cancer, number one in terms of heart disease, number one in terms of HIV. And I don't think we step and say, gee, we want to be sick. I think we step and say,
we don't want to be sick.
Gee, how can we fix this? And then it's on. So I want to, again, thank you for coming on and being candid and sharing. What do you see for the future in the American Cancer Society, in your role in terms of advocacy, in terms of just what you're doing now? Because it's a very powerful work that you do.
What I see for the future is that the American Cancer Society has a very aggressive goal. We hope to by 2015, and we're using that as a benchmark, we hope to alleviate cancer as a major health issue across the board in our communities. And we know that if that is going to happen, we need to do everything humanly possible with the citizens within our community, with the medical professionals, with the legislative representatives, to get those dollars to those researchers so that they can find a cure for cancer, that we can get these ordinances and these Senate bills passed that's going to provide more access to care for individuals who can't afford to get it on their own, that we're going to do something to alleviate smoking from the face of the earth, because we know that's a major issue, and especially in our community. If we stop smoking, that will alleviate lung cancer by at least 50%, just giving up smoking. And now we know, and we've known this for some time, that secondhand smoke is just as deadly as firsthand smoke. So smoking is something that we just need to do away with. And we have programs that are available for individuals free of charge, where they can take advantage of smoking cessation. And we know that smoking is very addictive, so we need not only the programs, but the support of the community and the efforts of the community to do what we can together as collaborative partners to eliminate smoking.
I understand there's some available screening programs. I want to refer again everyone to the American Cancer Society website. And they'll give you a wealth of information in regards to contacting representative, having speakers come. We really feel that, again, we must have partnership with these organizations and tell them our issues and our concerns so they can reflect the community that it serves. And we have about a few minutes left. Besides your advocacy role, how has this touched you personally?
What my volunteerism with the American Cancer Society has shown me is that cancer is not a death sentence anymore. It is something that no individual wants to hear the words, "you have cancer." But once those words have been heard, I know that there are avenues available to me to help get me through this particular crisis. And I know that there are many individuals out there willing to support me. And I know that with my persistence, I can find the doctors or the other medical professionals, be they male or female, white or black, yellow or brown, who are willing to give me the best quality care I deserve, frankly. And I know also, if by chance that is not working, there are special programs out there where individuals can use state-of-the-art medication that may not be, quote, approved by the FDA at this time, but many times we have to be creative.
And I would again advocate for the social economic issues in terms of food, clothing, and shelter, economics, and education. Again, risk factors in terms of tobacco avoidance, increased physical activity, and again, access to high-quality screening and testing, which is one of the pieces noted in the American Cancer Society discussion on African Americans. I think that I want to thank you, first of all, for coming on. I want to thank you for bringing light to a very, very dark world. And if vision is the art of seeing things yet unseen, then you truly are a visionary. We wish to welcome you back. We want to continue to have a dialogue. We think that's important to get the message out and to dispel some of the myths, because we think that education is the best medicine. And again, I want to thank the American Cancer Society for letting me come on.
Thank you very much for having me.
Thank you very much.
Thank you.
Thank you. Thank you.
Broken hearted, I surely came. Sons that were slain for minimal gain. Youth that can't read, speech that can't talk. Passion to move, but love that won't walk. I speak to you, my heart and my soul. My family and folks who I surely owe. My 100 double O nigga ride a flow to the beat, here we go. And it's so. I was born in the city of dope. If you survive with the live, gotta pray to cope. When the players pop the collars on the fade stroke. 76 keys of F3, I'm ready to go.